All right, and I think we have everybody.
Yes, I think so.
Yep, we do. Okay, perfect. Well, welcome back, everybody. Again, hope you had a good break. On to our last session for the day today. I'm not going to waste Talia's and all the rest of the speakers' time going through 7 different bios because they're all on the app and you guys can read them. But I will turn things over. I'll introduce our moderator of today's session. That's Talia Chappell. She's a public health analyst with the Federal Office of Rural Health Policy. A good partner of ours here at NOSOR and of all the state offices. So again, welcome everybody. Thank you for all the speakers today. But with that being said, I'll turn things over to you, Talia.
Thank you, Matt. Yes, hi everyone. As Matt said, my name is Talia Chappell and I am a public health analyst with FORP and am the EMS coordinator within the Medicare Rural Hospital Flexibility Program, known as the FLEX program. You can go to the next slide, please. So the FLEX program provides support to critical access hospitals and also provides participating states the option to incorporate rural EMS improvement as part of their funded activities. Today, we're fortunate to have 2 states, Florida and Michigan, as well as a FLEX technical assistance partner who have each developed or are in the middle of developing resources funded by FORP that are available in the public domain. Each panelist will talk a bit about their resource, their journey to develop it, and any related future plans. So without further ado, I will turn it over to Leila Shepard from Florida to start us off.
Thank you, Talia, and good afternoon. Again, my name is Leila Shepard Bowman, and I'm the director for the Office of Rural Health here in Florida. And I'm just going to provide a brief introduction about a FLEX grant funded project called the Rural EMS Leadership Program. And you can go ahead and advance the slide. There you go. And you can advance the slide again. There you go. Okay, so the program is actually an online educational series and it's designed to help improve operational and quality initiatives for Florida rural EMS providers. It's a joint partnership between 4 organizations, Swanee River AHEC, the Florida Health Partnership, which is one of the 9 rural health networks in Florida, the Florida Office of Rural Health, and the Bureau of Emergency Medical Oversight. The Office of Rural Health provided funding through our FLEX grant, and we provided also the expertise of our rural EMS coordinator at the time, Jane Bedford. The coordinator is actually funded with the FLEX supplement and the regular FLEX grants during that time. And the position is currently located within another bureau, the Bureau of Emergency Medical Oversight. The Rural Health Partnership, again, is a network, one of 9 in Florida. And they assisted with the operational and technical aspects of the project. And Beth Pate, who's with Swanee River AHEC, she will tell you a little bit more shortly about how she served as the project manager and bringing all the different elements together. Next slide. Okay, so why did we need this resource? Why was it created? Well, about 2 years ago, our rural EMS coordinator, it came to us with the idea of providing this online leadership educational series. And the main reason was to provide support and resources to our rural EMS agencies. As many of you may know, rural EMS agencies don't have big budgets for training or travel. And of course, rural EMS agencies have issues with workforce and turnover and retaining their employees. And so the idea from our rural EMS coordinator was, why don't we put together an online leadership training program to help those agencies? So what we did, we executed a procurement in April of 2019. And the project was completed by June of 2020. Next slide, please. Okay, So the costs basically for a project like this break down into 4 different categories. Costs for subject matter expertise, for those that develop the content of the modules. The platform, which is where the trainings actually reside. And then the metrics, the back-end data gathering piece. And then the project management or the person or persons that put it all together, they're the cat herders. And in this case, that would be Elizabeth Pate. And then the marketing and maintenance, the marketing of the program to the right audiences, and then just keeping the site updated and the content fresh and up to date. So the biggest cost came from really obtaining the subject matter experts and the content, developing that content that costs about $30,000. And then the platform along with the project management costs were another 20. So the total costs for getting the project off the ground were about $50,000. Now, right now we're in the middle of securing another procurement with Swanee River AHEC to maintain the site, keep it updated, and also market the site. And we budgeted between 18 to 20,000, more on the 18 side, and it could actually be less depending on how much needs to be updated in the site content and how much marketing you want to do. So really $50,000 to get it up and off the ground, and then there are maintenance costs. So without further ado, I'll use that phrase like Talia did. I will turn it over to Beth Pate with Swanee River AHEC, and she'll go into more details about the modules and how she herded the cats. Beth?
Thank you, Leela. Next slide. So a little bit about Swanee River Area Health Education Center. We are a nonprofit 501c, and we are located out of Alachua, Florida. And most of our organization does meeting and association services. So we help do association management like Florida Rural Health Association, Florida Public Health Association. And then we also do event management as well as program building from the ground up. Next slide. As Leela stated, we serve 12 counties. Mostly it's designated medically underserved areas, designated by HRSA as having too few primary care providers, high infant mortality, high poverty, or high elderly population. So we serve Alachua, Bradford, Columbia, Dixie, Gilchrist, Hamilton, Lafayette, Levy, Marion, Putnam, Swanee, and Union. Next slide. So Swanee River Area Health Education has expertise in continuing education. We are approved provider for 20 Florida healthcare professions, including physicians. We offer live and enduring learning opportunities for healthcare providers, and we offer over 30 online learning opportunities provided at little to no cost. Swanee River AHEC's learning management system offers high quality education. We record, host, advertise webinars for partners and clients, and valuable anytime learning in one integrated system for learners. Next slide. So a little bit of the structure of the Rural EMS Leadership Program. The Rural EMS Coordinator provided the subject matter expert to develop the content. Us as staff helped the subject matter expert develop a timeline for hosting the live sessions and recording the additional material that was needed. And all this content took about 1 year to develop. Go ahead with the next slide. So some of the leadership modules that we offered were what does it mean to be a leader, which consisted of learning the principles of servant leadership, the why, and the importance of personal employee wellness. We also offered management skills and operations, which provided management and operations lectures to learn quality and associate with good leaders. We also offered a course in quality and matrix, which covered information related to data metrics, quality improvement, benchmarking performances using the Malcolm Baldrige Quality Program and using the scorecard tool. I won't go into complete details of every single course, so you'll be able to see that in the future. Go ahead with the next slide. So the Rural EMS series, we will house this on the Swanee River AHAC site, which I will show you a little bit more of later. And I want to show you some content of the numbers that we've had in the past year. So you could go ahead with the next slide. As you can see, for each course, we had over 800 participants complete these courses over the past year. You could go ahead to the next slide. So a little bit of implementation and evaluation. So SHRAHAC hosted and recorded 2 of the live sessions. Experts provided 5 additional recordings. Our sessions were hosted on Zoom. Then we used Vimeo to record and edit and upload those videos. At the time, we used Qualtrics for our evaluation, and we housed those videos on Table Mesa and CE Broker. Florida CE awarded for completion of the program was a total of 14 CEUs. Go ahead into the next slide. So we're changing things up as we move forward with this course. We're working with the Office of Rural Health to update the content and market our site. We are no longer able to use Table Mesa since that website platform is being shut down. CE Broker is no longer an option because these training are free, and CE Broker charges now for courses to be taken. So SHRAHAC will utilize our personal website, and we will have a website to host and promote the Enduring program. And you can go ahead to the next slide. So if there's any questions for myself or Leila, you can go ahead and ask us at this time.
Yep, if anyone wants to put any questions into the Q&A or chat, and even if we need to come back to them, we can do that too.
Yeah, I think we'll continue with the presentations. Thanks, Matt. And we'll do questions at the end.
Thank you. And then I guess I will hand it over to Andrea.
Thank you, Elizabeth. Hi, everybody. Good afternoon. My name is Andrea Bass. I am the EMS Programs Manager with the Michigan Center for Rural Health, or otherwise known as the State Office of Rural Health. I am just going to be walking you through some of our resources and what we're offering through our office, especially when it comes to continuing education. Next slide, please. So first, we're going to talk about our EMS continuing education webinars. Next slide, please. These are offered through our office to rural EMS professionals. We also open it up to suburban and urban and other geographic areas to attend. But we mainly target the rural audience. Over 80% of folks that attend our webinars are from a rural landscape. And the reason we're bringing these continuing education webinars to rural landscapes is there's a lot of barriers that our rural providers encounter. They may not have the education stipend or fund that they need. There can be time restraints that go along with administrative constraints, distance to get somewhere if it's an in-person event, and also costs associated with the learning. So our webinars are offered virtually. And they are at a distance, and they do offer state-approved continuing education credits. Next slide, please. So when did this start? So technically with me, it started in 2018, but I will say that this program prior was going on. I just don't know a lot about it prior to 2018. So that's all I can speak on with you today. But what is the cost to offer these continuing education webinars? I would say we've done a pretty good job of keeping the cost minimal. So obviously the labor cost for me, which I'm the instructor coordinator. So in the state of Michigan, you need a licensed instructor coordinator to run a continuing education program. In addition to that, other costs would be a learning management system. Some are a little bit more costly than others. We actually leveraged a partnership, and we don't pay for our learning management system, which is a blessing for us. So if you can find a partnership with like your EMS partner somewhere in your community that already has a learning management system, that could be beneficial. Otherwise, that would be an associated cost. And then bringing in speakers. A lot of the work can be done internally. I've definitely done some of our webinars, but we find that our audience, I mean, they would tire of listening to me talk every month. So we bring in other EMS experts and subject matter experts, and many of them gracefully volunteer to do this. We do not pay the speakers, but we do provide PR and other things of that nature for the speaker if they're a consultant or associated with the business that they want to put out. So those are really the major costs. And then there are some ancillary things that I took for granted I didn't put up on the slide, such as, the use of Qualtrics for registration, which is at no cost to us, but depending on who's doing it, it could cost something. And then the Zoom platform that we use, depending, again, do you have to pay for a subscription or not? We do not have to do that. So those two resources we use quite heavily for registration and for the virtual format. So how do we do it? Well, I just went over most of that. So we have the participants register. It is free of charge for them. They come into the Zoom platform, and there are two platforms we use, either the meeting or the webinar function. And as you guys probably already know, those are different depending on how you want to deliver the content. And then we do attendance tracking and an electronic evaluation again through Qualtrics. And then we distribute our state approved CEs. There is some administrative labor associated with the CE process. As you know, in certain states, you have to monitor the back end of attendance, verify attendance, and then type the name of the participant and save the CE in a secure PDF file before distribution. So that time could also be of cost to your agency. And then how frequently we do them? We do them once a month. Next slide, please. So our niche, Michigan has a really robust EMS education program, and we found our niche really in EMS continued development. So a lot of our webinars are professional development and not so heavy on the clinical side. Our Bureau does a really great job of offering, large amounts of clinical education. We've done a great job of doing virtual options. And so our niche is definitely in the professional development realm. So a lot of leadership training, a lot of kind of offshoots of leadership. So we talk a lot about retention, social media use. We try to get topics that aren't already being covered by our Bureau. Last year, we distributed over 800 CEs. That does not include what we delivered through our on-demand platform in our state. Next slide, please. So a little bit about metrics. Next slide, please. So I just wanted to show you some of the things that we do measure on the back end. So these are just some snapshots from Qualtrics. So we do track a lot of data. That way we can go back and we can run like a year's worth of data. So this is just shown to you for an example, and this is just from one webinar. But we track, what licensure level the provider is that's attending our webinar. Next slide, please. We also gather feedback, and we want to know what the providers are using the webinar for. So even though I'm going to show you only a few examples of what we track, we do have multiple text boxes for them to leave comments, and we do go back. I personally vet all of the comments. And if there's any kind of like negative review or something that's concerning, I will reach out to that participant. Next slide, please. And then how satisfied they are with the educational activity. And this is good over a long period of time too, because you can look back and see how you're doing and average out, is the content being valued? Is it being rated well? Next slide. And then assessment of knowledge. So this is a trend for before and after. And obviously we want to see a trend that goes from not confident at all to confident. So we also measure that. Next slide. Thank you. So on top of all of those metrics, we do track, what county they're from, because we want to keep our rural census. Are they in a micro county, a rural county, a metro county? We look at speaker feedback, as I had mentioned earlier. We look at agency mix. We do compile that and see, are we having a lot of folks from one agency attend? And then we do review the comments and feedback. And this makes for a great data set over the years, really. Next slide. Thank you. So taking EMS education and taking it to another level. So we've been trying as an office to think outside of the box and bring continuing education to our audience that maybe hasn't been done before. So last year, for the first time, we piloted a live Zoom webinar in the back of an ambulance. And we partnered with Maternal 911. So the two ladies pictured in the front, they are both co-owners of Maternal 911, and we did an OP webinar with them. They happen to actually have on staff an intern that is really good with technology, and he helped us with the filming and connecting to Zoom. I will tell you, it did not look like an easy task. This was not something that I could see and replicate easily. Definitely a skill set, but it definitely went well. We did this in the middle of July, which there was some regret around. It was really hot in the back of the truck, but it went over really well. The audience enjoyed it. We learned a lot from the sound and how we could maybe better deliver sound. There was lots of feedback about angles and how we could set up the camera. So all of that was really great. It went for an hour and a half. And we ran through scenarios, and I was in the black in the back there. So I was acting as the provider and taking vitals and doing some of the techniques as we walk through live scenarios. This year, we're planning on bringing this offering back live again. We're going to work with Maternal 911. And this time we want to bring more of a real patient into the mix and see how that goes. So we can see that as this relationship develops, it would be great to do some live trainings. It doesn't work for everything. Obviously us being really focused on professional development, I've considered doing professional development live, but I feel like some of those scenarios would be better taped and then recorded versus you're going to walk through quite a few bloopers if you do something like that. So this was a really cool project, and we did offer continuing education for this as well. Next slide, please. And then we have our relationship with the Learning Assessment Center through the Michigan State University. So we partnered with them, and they have a really robust, they have the whole floor on campus of Michigan State University, where they have many rooms that are set up with technology. That's a simulated lab, and we can utilize that space in any way we want. So the Learning Assessment Center has a robust staff already in their office. We contracted with them, and we limited the class size to 16 folks. The reason we did that is we created breakout rooms where you could go from one scenario to the next. And sometimes we broke people apart depending on attendance and had them be true partners. So even in groups of 4, you're in an ambulance and you have a partner, and you start working with that partner. So it simulates a real call in a lot of ways. You're not really getting the hands-on, but the Learning Assessment Center could actually physically take you into a scenario and ask you what to do next. So you have a simulated patient, you have things in the room, and you start delegating. I attended a couple of these live, and I found them to be a different way of learning. And it was really, really engaging. This is not something that you can watch and walk away, and go make dinner or get on a phone call. You're engaged with this the whole time. You're treating patients at a distance, and then you're getting continuing education credits through this scenario. So I really enjoyed this. We continue to work with the Learning Assessment Center on these projects, and we hope to continue our relationship with them in using their simulated virtual distance learning. We did start charging a fee for attendance. I want to mention this because we do it for this and our EMS Leadership Academy. We collect what we call a deposit for that as well. The reason we started charging a fee is we learned that people pay attention to what they pay for. And what I mean by that is we had a lot of folks that would enroll and either not show up or they would cancel, literally like 2 minutes before, and then we couldn't fill that seat. So we would have a wait list to get into the class, and it didn't give us time to really fill those seats. And then we didn't know, the Learning Assessment Center didn't know how many folks they needed to run the scenarios, and that affected their staffing and then cost them more money on the back end. So we learned that charging a fee and holding those folks accountable really helped. So we stopped having those problems. We would have the occasional cancellation, but it was typically within the time frame we asked. So for us, it was 72 hours. That way we could get someone off the wait list into the class. So something to consider if you do provide free distance learning and you're contracting with someone and spending some money on it, sometimes a substantial amount of money, charging a fee will get some buy-in and people just pay attention to what they paid for. They don't want to lose their $25 or their $40. And so they're more apt to either show or cancel if they need to. Next slide, please. And then the last thing I want to mention, which I'll be talking more in depth about tomorrow, is we do have our leadership programming that is part of our niche, and we developed this program. Some of it's virtual. The academy itself we bring every year. It's in person, and this is another program that actually delivers continuing education credits. So when folks come through our academy, they get those continuing education credits. They do graduate. They do get a certificate. And our programming has continued to grow. So we now have quarterly leadership morning coffee group where the graduates, once they graduate, that's part of what they enter into. And this keeps rural EMS professionals connected. We also utilize this group for professionals to email in a question. You know, I need a resource or a policy or, you know, something they're needing for their agency. It can go out to the group, and then the group, if someone in the group has that resource, we can share it amongst the group. We have EMS graduate networking events where we'll bring everybody back together so they can continue their development. We do also, we've hosted in the past level 5 leadership retreats, which is also continued education. They have a private LinkedIn group that they belong to where as a center, we post things related to leadership, announcements, etc. And again, they do get continuing education credits for this programming. Next slide. So thank you so much. So next up, Nick.
Thank you, Andrea. I'll be speaking today with Sarah. There you are. I was just making sure that we're both here so that I'm not talking to myself.
Sorry.
That's okay.
No, wonderful. Can you hear me?
Yes, thank you.
Okay, excellent. Sorry, I called in on my phone because sometimes my internet has issues, which I think most of our audience can understand from a rural perspective, although I'm in a metro area. So there you go. So I'm going to kick us off today by talking a little bit about some work that Nick and I have been doing together on a quality improvement basics course for rural EMS providers. And if we go to the next slide, I can tell you a little bit about who we are and how we got here. So I saw some familiar names earlier. Some of you are familiar with Stratus Health. We are an independent nonprofit based in Minnesota. We celebrated our 50th year in 2021. So we've been around for a while. And although we are not a research center or a policy shop and we don't do direct practice, we see ourselves really as working at the intersection of those three things, leading collaboration and innovation in healthcare to improve quality and patient safety. So we do that work across a variety of settings, across a variety of geographies, but in particular, we have a long history of working with rural providers, including critical access hospitals and the National Flex program. Next slide. And so today I'm here specifically in our role serving as the Rural Quality Improvement Technical Assistance Center, which is a cooperative agreement that we hold with the Federal Office of Rural Health Policy through the Health Resources and Services Administration. So Talia kicked us off, and that is our role is in partnership with them as our TDEF through that cooperative agreement. And through that work, we really are focused on improving quality and health outcomes in rural communities by providing technical assistance to the federal office's quality initiatives and their grantees, including the Medicare Rural Hospital Flexibility Program, or FLEX, and that includes the Medicare Beneficiary Quality Improvement Project, or MBQIP. We also work closely with the folks at the Georgia Health Policy Center supporting the small healthcare provider quality improvement grantees. And we have a particular focus in all of that work on quality reporting improvement and then utilizing data. Next slide. Last year, F4HP came to us and asked if we would be interested in receiving some supplemental funds under ARKITA in order to develop a free resource to support EMS quality training needs. And the part of the initiative there and why we were pursued for that is that we have an existing quality improvement basics course that was created specifically with rural providers in mind, but is general enough to be used across other geographies as well, and is really quality improvement basics to help healthcare providers regardless of the setting of care that they are in. But it does kind of establish a setting of care sense. So the way that the course was set up was with some examples related to hospital or clinic-based care. And so what we wanted to do was build off of the existing infrastructure that's available through that quality improvement basics course and seek to develop some specific EMS examples. And so we were able to secure a subcontract with our EMS subject matter expert, Nick. And I'm going to turn things over to him to talk a little bit about how we rearranged the quality improvement basics course and how we are adding to it in order to make it specific to rural EMS.
Thank you, Sarah. Next slide, please. So the outline of the EMS QI basics course, like Sarah said, we're just adapting the existing material to better fit the EMS audience. So you can see the wheel there. It addresses the different kind of topic areas of the QI basics course. It includes a number of modules that highlight the important aspects of quality improvement, introduces them, and provides some EMS contextualized examples. The two types, or I guess the two EMS examples that we're using is a current initiative that's a national initiative actually with reducing the use of lights and sirens. So we're using the lights and sirens response and transport of patients topic as one of the EMS examples. And the other is related to accurate documentation of vital signs by the EMS providers. So those give us a good lens into the quality improvement practices and provides a good foundation for an EMS provider in a rural area to be able to practice their improvement techniques. Next slide, please. We did this based off of a tiered model so that we could address the why, what, and how aspects of quality improvement. So we answer the why question with the awareness level. We're able to explain why QI is important and why any EMS providers should be interested in improving their care. Then we build off of that with the what section, which is kind of introductory, gets a little bit deeper into what QI projects are, what entails a QI project, some of the tools that would be involved, so that a person who has attended this level would be able to perform a quality improvement project in their own EMS agency, maybe with a little bit of assistance from somebody that's in the next level, where the advanced QI basics provider would be able to address the how to lead a QI project, how to do data analytics, how to do the different pieces of how to, let's say, lead change management, things like that. That would be something that requires a little more investment in training and time. So at the advanced level, you would get a good, it's a good preparation for somebody to lead a project or to guide other people to lead projects themselves. Next slide. And so I've pretty much covered this one already. This slide is just highlighting the EMS examples that we mentioned. So next slide. In this, the introductory or the what is QI area, the main topic points are listed here in the bullet. So the team concepts, which is a really important topic for EMS providers. Oftentimes our QI projects in a hospital setting or a healthcare setting involve a lot of different people from different departments. And we needed to provide an ambulance provider or an ambulance service employee with the same kind of infrastructure for their team. So helping them understand that their team may involve people in the community, their county commissioners, people from the hospital or other settings. So tying that concept back into the ambulance service environment was really important for this particular course. So then we go over communication and the change management, data basics, etc. Next slide, please. That advanced level just digs a little bit deeper, provides a few more of those advanced tools, because again, this particular person should be able to perform a project on their own or support somebody else. Next slide. I'll turn it back over to Sarah.
Great, thanks, Nick. So Nick gave you a high-level overview of what is more immediately what we are planning. And so what we're looking at is hopefully being able to complete the EMS contextual examples and launch the site sometime in June 2022. And then we'll work on promoting availability of the resource through state flex programs and other partners. In the more midterm, we'll be looking to track our web statistics to see what uptake looks like and how many folks are completing the various different levels of the course that are being provided, and then look for feedback from users in order to inform some continuous improvement on our end. Longer term, we're looking to develop a facilitator guide for those that are interested in pursuing completing the course modules through a cohort-based approach. So if you wanted to convene a group to go through it together, we would have that facilitator guide available with some prompting questions and some things to think about, as well as some suggestions for kind of how to organize it. So while it's broken down into 3 tiers, you can see that middle tier has a number of modules within it. So if you're thinking about convening folks over a series of maybe 3 or 4 meetings, what makes sense to kind of chunk out and approach together, and then building out some additional EMS specific examples going forward. Next slide. And that's what we had for you today. So we welcome your questions and thoughts, and what we're still in development to some extent. So we also welcome your feedback on what would be most useful. I'll turn it back to Talia.
Great. Thank you so much, Sarah and Nick and Andrea and Leela and Beth. All of your hard work is certainly appreciated, and all of these resources are, I'm sure, of interest to a lot of our audience members out there. If anyone has any questions or comments, I know there was one about Qualtrics that got answered in the chat. But if there are any other questions, you put them in the Q&A so that Matt can track them. That would be great. I might just start with one question for all of our speakers to think about a little bit. Have there been any aspects of your projects, like through the projects?
I think we just lost Talia. What?
Sorry, everyone. I think I just dropped off.
Nope, yep, you're back, but you're good. Yep, you're back.
I actually got an email earlier this afternoon from Verizon saying there's an outage in our area. So I apologize. It may happen again. So I'll just repeat the question. So for all of our speakers, if you can think about any aspects of your projects that were either easier or harder than you thought that they might be. So if there's anyone out there that's thinking about developing perhaps their own type of online modules or online learning courses, things that they might be considering to, watch out for. I'll just ask, I'm going to put somebody in the hot seat. So I'm going to ask Andrea if she might start us off with some thoughts on based on her project that she's been involved with.
Sure. Yeah. Let's see. So the first thing that comes to mind is easier. I would say that things are easier if you just get started. So, you know, the analysis paralysis of filming live in the back of the truck, you know, I showed up so nervous that day. What if we have a technology issue? And even prior to that, when we were rehearsing, you know, I was very nervous about it. So my advice would be, you know, once we were finished, I really felt like it was easier than I thought it was going to be. And it went on without any issues. The other thing I'm learning is if you can delegate something to an expert, you know, when it comes to filming or bringing in an expert speaker, or depending on how your office is structured, you know, delegating the distribution of CEs or any administrative duties, that can really help free you up so you can then create another project and offer more value to your rural communities. So with that, I think those would be my two things.
Yeah, thank you. Beth and or Leela, do you have any thoughts on anything that has been either easier or harder than you had anticipated?
I think Beth might have more comments, but there's one thought. We should have probably thought about the marketing and keeping the content updated, you know, at the beginning.
That and the sustainability of a platform that you're housing your content on. So that's been our struggle, is moving all of our courses from Table Mesa now and finding a platform where we can still offer those courses for free and being able to offer the continuing education to link to those courses. So we had to do a little bit of, you know, thinking on our part, where can we have these courses? And then, you know, ideally it would be a nationwide place like, or, you know, a state place like CE Broker, but to be able to maintain them for free, we had to think, okay, well, we'll have to put them on a Stray Hack page. And now we're still in the process of how are we going to market those? You know, like a lot of people go, who is Stray Hack? You know, like they would never know to like Google our page to look for EMS leadership program. So we're still strategizing on how to market those courses once we switch them over to that page.
Great, thank you so much. And then Nick and Sarah, you're still a little bit in the throes of your project. What have you found so far?
Well, I would say that our biggest challenge was identifying really the best EMS examples of the types of projects that people might do. Every EMS organization is unique in its own way. And so trying to find two common examples that would apply for BLS or ALS services, or paid or unpaid staff, or critical access hospital operated or volunteer in the community. All the different kinds of organizations have their own nuances, but we wanted them to be meaningful. So that's why we decided to use the lights and sirens topic, since it's a timely topic that's of interest to a lot of people right now. And then vital signs, because everybody has to check vital signs on every patient. So even in a small rural service that has a very low call volume, they will have an opportunity to participate by using the vital sign example, at least. It's the biggest challenge.
Sarah, do you have anything you'd like to add? I don't want to leave you out.
No, I appreciate Nick weighing in there. That has been our biggest challenge to date.
Great, wonderful. Well, again, thank you so much. And, you know, the slides will be available from all of our presenters, and you can check out their resources if you have interest in them. And I think they're all more than happy to answer any questions you may come up with later on. They've all got their contact information available. And I think I'll pass it over back to Matt. I think we'll give you some extra time.
Yeah, definitely. Thank you, Talia. Thank you, Nick and Leila and Andrea and Elizabeth and Sarah and Jane. I appreciate you guys being on here to end our day with giving some good resources for folks going forward. And like Talia said, yeah, the presentation will be up, so you'll have all the contact information, and then the recording will be made available next week after the conference. So we have all the access to that. I don't see any questions in the Q&A, and I think we got the question answered in the chat. So I think we are good on that. So again, thank you all for being on today. I really appreciate it. Look forward to seeing what tomorrow has to offer on the agenda and seeing everyone again. So again, thanks to all of our sponsors for today and all of our previous speakers that were on. I enjoyed all the questions we got coming through, the dialogue in the chat, and I hope we keep that up for the next 2 days. So everyone have a great evening. And like Talia said, we'll give you 15 minutes back, or 14 now for that. But again, thanks everybody. Have a wonderful evening, and we'll see you all back